Hi guys, my name is CJ Satyaswaran and I'm a third year nursing student at Ontario Tech University, and today I will be talking to you about the COVID-19 vaccine and the hesitancy in Canada and in particularly in Ontario. Let's start off with some background information. Well, vaccine hesitancy is a barrier that has affected vaccine uptake in many parts of the world. In Canada, the government is looking for innovative ways to increase its vaccination rates. As of January 7th, 2022, 76.83% of Canadians are fully vaccinated, and 82.56% have received at least one dose of the vaccine. But what truly is holding back the 23.17% of the individuals from being fully vaccinated? Well, abstaining from receiving the vaccine not only impacts the individuals not wanting to receive the vaccine, but it also affects people around them as well. It also affects our healthcare system as a whole as well. With the new rise of the new Omicron variant with a high rate of transmission, Ontario has agreed to enforce a fourth lockdown to minimize the rate of transmission. This could have, however, been avoided if more individuals were fully vaccinated. The only way to fight the novel coronavirus is to continue to build immunity through vaccinations, which a handful of individuals are still hesitant to receive. So let's take a look at what is vaccine hesitancy. Well, according to World Health Organization, also known as WHO, vaccine hesitancy refers to a delay in acceptance or the refusal of taking a vaccine. It can be influenced by many factors such as complacency, convenience, and confidence. Why might many groups or individuals be hesitant? Well, in Ontario, we have a lot of different and diverse groups of people that reside here. So there can be many factors that influence their decision making skills. So, for example, some factors include religious affiliations, cultural differences, short term and long term side effects, stories and conspiracy theories about death associated with the vaccine, which were heard from family, friends, and other healthcare workers, and their own personal preference. Many others have also suggested that they do not want to get the vaccine because of concerns with fertility and concerns with existing autoimmune diseases. However, according to the CDC, there is no valid claims to these statements. Some other claims made by some ethnic minorities include that the vaccine was created way too quickly and that these individuals do not trust the government. In Ontario, we are run by the Conservative Party, which is run by Doug Ford, which a lot of ethnic minority groups do not really favoritize. Let's take a look into why and how healthcare workers can support individuals and address this concern. As healthcare workers, we must understand vaccine hesitancy to help individuals make evidence informed decisions towards the health of themselves and towards the health of others around them. Therefore, we must make an initiative to debunk myths regarding the vaccine and its associated complications and help citizens understand the benefit of receiving the vaccine. Healthcare workers can educate people in the community by having phone calls or virtual calls with vaccine hesitant individuals to better understand why they're so hesitant and to offer some support with evidence informed data to help them make a better choice. Other methods could include handing out information pamphlets about the benefits of the vaccine, or by going door to door, or by doing both. Another new and fascinating way in the modern technological world is by posting content on social media accounts. This is via Facebook, via WhatsApp, Instagram, Twitter, and Snapchat. By addressing these concerns using these social media platforms, we could reach way more individuals than we can on a face to face level. This allows people to communicate and spread more positive and more evidence informed information to people across the globe. In Ontario, there are still many individuals who are hesitant to receiving the vaccine. Despite Canada being a first world country, we still have many immigrants and many individuals who are still moving and adapting to the norms in Canada and in Ontario. According to the Public Health Department of Canada, the Indigenous group, Latinx, and Arab Middle Eastern communities were more likely to be hesitant due to cultural differences and hesitancy to some Western medicine and vaccines. Some other reasons to why Ontarians are hesitant is because they don't trust our current government system. Currently, as mentioned before, our government in Ontario is the Conservative Party, which is run by Doug Ford. And many individuals assume that he hasn't been able to keep his promises, and his views on Ontario is through the lens of a businessman, which doesn't really support many families or ethnic minority groups, as these individuals are working for low income jobs or low paying jobs, and they don't make much of an income that can sustain a family. Some resources available to address vaccine hesitancy include a document made by Public Health Ontario, which is called the Building Confidence in Vaccines document, which can be found on the link noted. The Ministry of Ontario also released a COVID document explaining what COVID is, how to prevent COVID, and how to be cautious of COVID. It also looks into different stats and the vaccine stats of people in Ontario. The Indigenous Primary Healthcare Council also offers various resources for the Indigenous community and have also prepared a document which is in the provided link. The CDC website also has a link with contact information to various healthcare professionals with regards to information related to COVID-19 and the vaccines. This helps people engage with trustful people and gain more information from the right people. Your very own local public health region website would also have many useful links and information regarding COVID-19 and where you can get your vaccine and where you can book one. It also offers information of the rate of transmission and the rate of individuals who have been getting their first and second dose of vaccines. So that is also very interesting to look at, which can be noted in the two provided links. Many other resources are also offered at hospitals, at your very own doctor's office, and can be found all throughout many government websites online. Well, how can healthcare workers address issues pertaining to vaccine hesitancy with their clients? Well, number one, addressing barriers to vaccine uptake, such as addressing vaccine misinformation. This is a critical and important thing to do, as many individuals are running off of conspiracy theories and stories told by families and friends, which most likely aren't true. As healthcare workers, we must help educate the public of the myths and the false information that's spreading and provide them with the true facts and evidence informed decisions with regards to the vaccine. We're here to provide you with the most updated and most accurate information. Number two, meaningful engagement with marginalized communities and prioritization of culturally safe approaches to communication and implementation. What I mean by this is that we must reach out to marginalized communities and reach out to people in these ethnic minority groups and help them better understand the importance of the vaccine and how it can prevent possible future outbreaks and possible future new variants that easily spread in the community. Growing up in Scarborough, I grew up in a close knit family. So it would be five members of the family, including grandparents and my grandfather who live with us. So when living in a community like this, the spread of transmission is much faster. So if we were to somehow get everyone in the family vaccinated at a quicker rate, we could stop the spread from our community ourselves. So like that's my family. It helps spread the virus from going into other families and other members in the complex that we live in. So to do this, healthcare workers must help educate these marginalized communities and work together with them to help inform them of the benefit of the vaccine. And healthcare workers must do this in a culturally sensitive way. As many different cultures have their own ways of living life, we must learn to understand their culture and work together with them. For example, the indigenous communities have their own customs and are usually don't agree with westernized medications or westernized style of healthcare. So what we must do is help educate them on still holding or being truthful to their own cultures, but to adapt and be aware of Western medication and to accept that as well. Number three, partnering with champions and communities to inform approaches to addressing issues of trust and confidence in vaccines. So as healthcare workers, we must work together with our very own local government and trustee to help build trust and confidence in the individuals who are hesitant of getting the vaccines. So as healthcare workers, we must partner with our local trustee, such as, let's say, NDP office or let's say the Conservative Party, and we can work with the local trustees and maybe go door to door with the healthcare worker and build a stronger rapport and trust in the community by speaking to them and educating them about why we should all be vaccinated and how we can prevent the immunocompromised individuals from obtaining the virus itself. The only way to fight this vaccine and to fight COVID is to work together as a team. Thank you. Now I'll be sharing with you some personal experiences that I've had and personal stories that I've learned from working on an acute medicine / COVID recovery unit with many individuals from a variety of ethnic groups. One patient, when asked why they were hesitant to be vaccinated, explained to me that they had a family member in Jamaica who had died after getting their first dose of the Pfizer vaccine. This can possibly happen. However, I personally assume that this is not because of the vaccine, but it could be due to other health concerns that this individual has neglected. However, as healthcare workers, we must still be able to promote the vaccine, explain the minor side effects, and outweigh the benefits and the efficacy over the minor side effects that these individuals may experience. Another individual who came to me, or didn't, who another individual who I visited during my rounds, explained to me that they just don't believe in the vaccine. They didn't like the fact that the vaccine was created in less than 1 year, and that if this was possible, that the cure for cancer could have been easily found too. So they were kind of hesitant because everything was done so fast, the virus is just spreading, and they weren't too sure if they could really trust the virus or trust the vaccine, as this virus keeps mutating and spreading very fast. They were also hesitant because of some rumors and conspiracy theories that they've been hearing all over the internet and from family members on WhatsApp groups, which have been kind of convincing them not to get the vaccine. However, as a healthcare worker or as a nurse extern, my duty was to explain to them what the COVID vaccine is and why someone should take the vaccine to help prevent future outbreaks and to prevent other people and immunocompromised individuals from obtaining the virus. After spending nearly 20 minutes with this individual, I had convinced him to get the vaccine. So eventually, I spoke with the nurse, and the nurse said if the patient is stable enough and is willing to get the vaccine, that we can contact the vaccine person downstairs and they can come upstairs to get them the vaccine. So at the end of the day, one of the patients did end up getting the vaccine, and I was really thankful that I was able to provide him with the necessary information needed for him to get the vaccine. The only way to fight this novel coronavirus is by working together and being supportive of each other. We must all do our due diligence to stay 6 meters apart, get our vaccine, our first, second, and our third booster dose, and help each other out in times of need to get through these rough and unstable times. I would like to thank you guys for taking a moment to be present in my presentation, and I'm wishing you guys a great semester. Thank you.